Neil right on the head. And I remember I put this on my Twitter handle just about 2 days ago, that why do we have to depend always on the West? When it's HIV, it's the West. When it is aid for our budget, the West. It is something else we need, the West. Ebola, we have to go to the West. We have a lot more trained professionals who will also go to the Johns Hopkins, go to the best research institutions in the world. There will be health ministers in their countries, and they can't do anything just for their own continents.
I don't think they can't do anything for their countries and their continent. The question is, are their governments committed to funding serious research in their countries? And are they committed in making sure that those researchers are given the necessary incentives and motivation to stay in the laboratories and in the fields to carry out 21st century research into some of these problems? That is the question. When you train someone and he comes to the lab and meets obsolete equipment, how is the person going to perform his task? I don't think they are weak or they don't know what they're about, but the commitment must come from the government and their institutions.
By your observation, do you think that we have the capacity?
I think we do. Government must put in the necessary resources, and I think our researchers will be able to deliver. Noguchi has been performing creditably. When we want to test for malaria or some of this tropical, we send it to Noguchi. Everybody says, oh, let's wait for the outcome of the laboratory results from Noguchi. Somebody assisted us. The researchers are doing well. Aren't they doing the right thing? They are. So the commitment must come from the politicians and the government of the day.
Now that takes serious, it's taking serious funding from the Japanese government over the years.
Yes. What if they decide not to fund it again?
Yeah. It's a question that I think you're a legislator, so you can raise some of these things on the House. But now in going forward, how do you think that with the current difficulties we're having with the economy and disbursement likely to affect our preparedness financially to meet some of these challenges like cholera and Ebola, especially, since we have to buy logistics and make those provisions monetarily?
You see, thank you. Last year alone, the budget for the Office of Government Machinery was over 300.
What is Office Government?
That is the Office of the President and the agencies under the Office of the President.
We're told that there are many. It's not only about...
Yeah, over 316 billion.
Million.
Million. Is that not too much?
By my estimation, yes. By my estimation, yes.
Yes.
But the officials buy four-wheel drives and things, so they take a lot of money. If you want to run government, it's expensive. Is that not what you say?
It's expensive, but you have to prioritize. How much are we spending on research? How much are we spending on the critical areas that most Ghanaians complain of? Our health insurance is collapsing. 90% of our scheme
we'll talk about that.
Saying that they are not. So our infrastructure is weak. Our police institution is not working well. Military, they are under-resourced. VTB bank loan is in serious jeopardy because VTB, you ask, I'm sure you are surprised. VTB was raising money on the American market, and they've been hit with the sanctions by the US and the European Union. So they cannot raise the 300 million needed to finance the agreement that Parliament approved for our military and peacekeeping operations. That's why I'm sure you're surprised. That is the angle. So the seriousness must come from all of us, and the government must show the way.
Okay, so now in going forward, it means that we have to tacitly be ready for it. Anything can happen. We seem to be in this very fool's paradise and this whole euphoria, thinking perhaps because we've not recorded cases, I mean, admittedly publicly, we won't record cases. It can't happen because we have flights coming, we have people crossing our borders sometimes.
You see, we are so focused on flights coming in, buses. What about our fisher folks who go from our coastal towns to Liberia, Cote d'Ivoire, Guinea, and what have you? Are we able to check their ins and out on their canoes? What measures have we put in place? Those are the critical areas that we must look at. They go, they have families in Liberia, they go, they fish, they go to Guinea, they work over there, and they come in their boats and canoes. What measures are we putting in place? So somebody can come to a coastal community with Ebola and you wouldn't know. You would have put in measures at the airport and the ports, and also at Aflao, Elobo, and other entry points. What about those coming in by boats? That is another area.
So it means that we still have a lot of leakages.
We have a lot of leakages to look at.
Okay. As far as we're concerned, we're told by public health officials in charge of the Greater Accra region that over 2,000 cholera cases have been recorded by various public health facilities in the region. Now, that really is a concern not only for them but for residents. And how did we get to this point? And so far, with the cases that have been recorded, how do we make sure we don't get to the next stage? The health officials say they believe, after doing their own observations, that perhaps some water sources, coupled with the current sanitation crisis we're facing, may or could be attributed to the current cholera cases that we're recording. For you, you are a member of parliament for a constituency that also have some densely populated communities. Are you worried?
I am very worried. And those days, when you hear of cholera, you think about certain communities in Accra. Now, cholera cases are recorded around airport residential area, Roman Ridge, the so-called elite zones. You won't talk about the very undeveloped areas in Accra. If you go to Abeka, my constituency, Fadama, La Paz area, so densely populated that I become so worried when I walk around in the mornings to visit the communities, and the filth. It took the vice president to go around Accra to help in cleaning the city, whereas we have people that we are paying to be in charge of some of these programs. It's very unfortunate. Shows you the kind of leadership we have. Secondly, if somebody shows signs of cholera, you're supposed to visit a health facility. And that person, after visiting that health facility, is given a prescription to go to a pharmacy or whatever. That person is a beneficiary or has paid to subscribe to the National Health Insurance Scheme. The scheme has totally collapsed.
What's the meaning of that?
One, if you are given a prescription to go and buy to a pharmacy that falls within the health insurance arrangement, and you go there and they tell you that, oh, we cannot give you this medication because government hasn't paid us for the last 6-8 months.
Well, that's because there's a caveat. It's because government hasn't paid or hasn't paid the insurance authority for the insurance authority to also pay the providers. That's why.
What should that poor person do? Should that poor person go and die because of government's inefficiency?
But Mr. Boama, that doesn't amount, or you can draw the conclusion that means that the scheme has collapsed, has it?
Oh, but if the scheme is unable to pay for the pharmacy chamber and their membership, and that chamber is unable to release medication to a sick person, what conclusions do you draw? If the scheme were to be working well, why aren't they able to pay the pharmacy chamber and all the service providers? Why aren't they able to do it? All the statutory funds are in arrears, yet government keeps singing hymns to the population that, oh, government is doing well, we are going to pay so and so on Saturday. They keep failing on every promise that they make. And it's gotten to a point that nobody takes them serious.
Now it means that we have to undertake a lot more sensitization in communities. The public health officials believe that perhaps water sources also may have been contaminated, and we have sanitation issues already lurking around. It means that perhaps we need the metropolitan as well as the various sub-metros working than they usually would be working.
You see, the government has weakened all those institutions that are supposed to carry out some of this education that you are talking about. The MMDAs.
How?
Their common fund is in arrears. Some of the monies that they will need to
that's why you draw that.
Yes, they will need to go around to sensitize the communities. They don't have it. They can't even talk because people are protecting their positions. It's about time that they come out to tell the whole country that they are suffering. Government must take steps to release their common fund to enable them go down to their communities. And I also urge all MPs and any interested Ghanaian who has the country at heart to take it on board to at least educate people within their reach on cholera and the Ebola and any other disease that they...
The Health Insurance Authority has reacted to the press conference that was convened by the minority in Parliament I believe on Wednesday. And
yesterday.
What was your concern?
See, our position that the scheme is nearing total collapse stands unchallenged. What the Health Insurance Authority came out to say that a scheme which is collapsing has increased number of people paying the premiums and what have you.
And accessing.
Accessing it. Those who are providing the services that you claim people are paying the premiums to access are telling you that they keep turning away people because they are not receiving what is due them statutorily.
But these are temporary. These difficulties or challenges are temporary.
It takes a second to lose a life. So a temporary measure should last for 6 months. And you know the number of people that will die in this country if they are unable to access effective health care or efficient health care. So the skills and the numbers that they generated through their PRO was unfortunate. They should have told us or rebutted what the minority said or what the CEO of the pharmacy chamber came to corroborate. That is what we were expecting them to attack, not to come out and issue or give us numbers.
If you convene the press conference and in the content or wordings of your statement, you say because of these actions, it's leading to mass murder. And of course, it's been explained by Dr. Matthew Poko-Prempeh, etc. Aren't you polluting the atmosphere and creating negative publicity for the scheme? A scheme that really is assessed by, is it the generality of Ghanaians who perhaps may also fall below the normal income generating bracket?
You see, I would want you to go to the street and ask anyone who has subscribed to the scheme. They will tell you that they won't even waste their time to go to the hospital
using
the health insurance card. They will tell you it's just an ordinary card that they are handling or holding. So if I pay for a service and I'm unable, look at the number of the PRO brought out a figure of about 24 million people, 10 point something million people on the scheme. And he says it keeps rising. If 50% of them are unable to access it, and the effect is that their health conditions will keep deteriorating, or they are dependent. You know, the scheme also has provision for dependents and the aged and certain category of persons who must access it freely. So what becomes of those people who are unable to? It means you are going to send them to the cemetery. So mass murder was used in a context, and I don't think it should be taken out of context.
Okay, and so far you want the NHIS to sit up, but you know that it's not the fault of the NHIS because it's not been getting releases from the Ministry of Finance.
I'm surprised you are saying it's not their fault.
It's not the fault of the NHIS, is it?
Yeah,
they are not getting the allocation from the Ministry of Finance.
But have they come to tell the country that? They keep defending the obvious. They say the scheme is not collapsing. They are not saying that they are not receiving monies from the government. Sylvester Mensah is chief executive. He's a member of the government or the NDC government. Has he come up publicly to talk about the challenges they are facing, rather than saying that, oh, the scheme is doing well and that whatever the service providers are saying is not true? The issue of capitation is very, very serious, which they must discuss. And I think they must come out with the truth and tell the country what they are facing. Yeah.
Okay, and we have on the line our reporter, Chenchehine, and Chenchehine is based somewhere in Accra at Amasaman, I'm told, and would want to get a lot more insight into what is happening as far as the treatment of cholera cases in those communities are concerned. A very good morning to you, Chenchehine, and what's happening around you as far as cholera is concerned, its treatment?
Hello.
Well, hello, good morning. And
hello, Roland.
Where are you currently, and how far are health officials able to treat the cholera cases that they receive for emergencies?
Yes, Roland, I'm right here at the West District Hospital here in Amasamai. I've been speaking to people right here to find out the current situation in the district hospital. Now, the number of cholera cases, I'm told, has actually skyrocketed. Over the past week, I think they've recorded over 100% increase in the number of cholera cases here at this particular hospital. I've seen a lot of structures that have been erected, tents that have been erected, so as to cater for the numbers that keep on coming. But I wouldn't want to talk too much. Let me quickly speak to the deputy in charge of cholera unit right here at the hospital. He's in the person of Mr. Kofi Ejay. Let me talk to him and get to find out what is really happening over here. Mr. Ejay, good morning.
Good morning. Actually, we have service, and about 70% of the rural folks here are poor. Let me say, the inhabitants here are very poor. So, and cholera mainly is what when you don't keep your environment clean, definitely going to get cholera. So we've been educating them that they should keep their environment clean. Actually, they come in here, we manage them so that when we see that your condition stabilizes, we discharge you. We manage them with the infusions, and the district provides the infusions, like the 541, the ringers, and tetracycline. We also protect the relatives who bring them here, like create like something like a barrier nursing or something. Yeah. Yeah, because you get in contact with the person. The fluids, when the person vomits, it hits into the boat, bounces back. You inhale whatever the person brings out. So you need to protect the others so that when you get to the house, they wouldn't get infect the rest in the house. Yeah.
Something you mentioned that you manage the situation, and when they are okay, you discharge them. Does it mean you don't wait for them to fully recover and you just discharge them?
Due to the increase in the cases that are coming or something, we can't allow the number of deaths here are not enough. So when you see that you're stabilized, you're not passing stool, you're not vomiting, you see you're okay, you have to go so that we give your bed to the other patients or something.
I can see you've mounted some tents out here. Is it to also cater for the increasing number?
But yes, please. So they are here to provide beds.
How safe is this in any way? Because it's outside also. Assuming, okay, I just saw a bin some meters away, but isn't it in any way, can't it in any way affect the same people you're trying to cure? They are still outside, they are still exposed to the dirt and filth.
At the initial stages, when there was the outbreak or something, the district management team, they came here and they came to survey the place. So these structures are improvised. They are yet to bring out a nice structure or something so that we can manage them. So these ones you see are improvised. So they are working on their ground. They are working hard to implement.
Can you give us some statistics of the cases you've recorded over the past, say, 2 or 3 weeks?
Actually, sometimes when they come to the hospital, because they ask them at the OPD, oh, are you passing stool? Are you vomiting? If the person has passed 2 or 3 and they think it's cholera, they come here and we investigate. It's not cholera, it's gastro. We send the person back. For cholera, you need to vomit, and your stool has to be watery. That's the main signs and symptoms, the clinical feature. So when a person comes here and we investigate and we see that it's cholera, we admit you. Even the doctor doesn't review. We admit you after you are healthy, or you see we can go to that before we let the doctor review you. So we keep on managing them.
You mentioned that last week when we checked you had about...
Yeah, 58. Right now we have 140. 140. Yeah.
That's more than 100%.
Yeah.
Are you sure you'll be able to manage the numbers as the weeks go by?
Yeah. And God being so good, they are not the same people we manage at Akami, which means we are making our best. They are different people. And as I said earlier on, it's short that is bringing about this cholera. Yeah, it's short. So we need to educate them on proper personal hygiene and also educate the relatives where they buy their food, where the kind of vegetables they use in cooking. They should wash it well properly. They should wash their hands after visiting the giants or something. It's not everyone at the suburb of Amasama has water coolers. They all use the KVIP, and we need to sensitize them on that.
Have you recorded any death situations since the outbreak of this cholera?
One, the president. Yeah, that was on the 21st of July. We got one death. Yeah.
Do you foresee many more numbers in the coming weeks?
No, like say today, for instance, we're only having 11 cases and they are all fine. None has come.
You haven't received any cases today?
Yeah, we've not received any cases today.
I mean, I just need to. So that means you could still receive
like 3 to 5 there. Yeah.
I see. Okay. So, Roland, you've been hearing the deputy in charge of the cholera unit right here at the Gan West District Hospital in the person of Kofi AJ, and he tells us that they are trying their best to manage the situation, and they've actually improvised so as to cater for the huge numbers that are trickling in. And when I say huge numbers, I mean they've actually recorded over 100% increment in cholera cases over the past week alone. It's quite surprising, though. But from right here from Amasamai District, basically, this is what I'm able to report, unless, of course, you probably have a few more questions you would like me to answer.
100%. What does it mean? How many cases and numbers are we talking about?
Last week, they had about 68 cases, and as of today, they've recorded 140 cases.
Okay. Is the medical person still with you?
He's still with me. He's still with me.
Can you ask him whether he believes that perhaps beyond fecal matter, maybe water sources may have been contaminated?
Well, okay. So...
Because most of them drink from their borehole, they don't cook properly. We educate them. The district management team, they have a van, they go around and educate them. You know, our people, they have bad ears and don't listen. So they go in for the borehole.
You blame them. Probably they do not have access to potable water. So where else can they get the water? How else can they get water?
That's the only source of water. So that's why the heads of department, they have to work on it and provide them a better source of water. That's why it's beyond.
So aside the education, what more is your outfit doing?
Okay, right now when they come in with the patients, we are doing our best to protect the relatives also by giving them like some first aid and the tetracycline to protect them so that they don't go, and we educate them before the person leaves there. Make you wash your hands properly. You get to the house, the clothes that's brought here, you didn't use it, you should put it in water, soak it, or wash it before you use it the next day or something. So that's the best we are doing for now.
Quickly, just before we go, I'd like you to give us a brief overview of what usually happens when a person gets cholera. Just let's say symptoms, maybe first 2-3 days, what the person should feel. That should immediately prompt him that, okay, you know what, I probably might be having cholera, I need to do A, B, C, D. And the immediate measures that can be taken.
So when the person gets cholera, the first instance, the clinical feature shows the person starts vomiting. And the vomit is very It's very, let's say, watery. The stool is very watery. That's a right shorter stool or something. And the person passes it frequently. Frequently, it comes out as you vomit, you're passing the stool. And moreover, our body is made up of 95% of water. So as you keep on vomiting, keep on passing the stool, you are losing electrolytes, fluids. So you become, in the initial stage, you become very weak. And when the person stays in the house for long, the person gets these sunken eyes. The eyes got gross and sunken eyes. So it's a major feature that tells us that no, this is cholera. Or you see the person vomiting, passing stool. You can't control it.
It has to do with the vomit and the frequent passage of stool. So are there any immediate measures one can take at home, even before he or she comes to the hospital?
You can get the ORS, use the Vortic, the Vortic water ORS, you need the ORS, you take it, and it can sustain you, so they bring you to the hospital.
So, Roland, again, as I mentioned, that's the deputy in charge of cholera units, Mr. Kofi right here at the Gan West District Hospital in Amasamai. And, cholera cases in the country has actually increased from just about 800 to over 2,000 cases just within 7 to 10 days. So right here at Amasamai, though, their cases have increased from 68 to about 140, as I indicated earlier. That's a significant improvement. I mean, over 100% increase over what we reported some time back last week. So, Roland, from Amasamai right here, that's what I have for you.
Well, thank you very much. Kwabna Chenchenhine Boating giving us that report for Amasamai. It means that the situation is as serious as it can get.
Yeah, sure. The doctor has given us the numbers. Your reporter has also given us certain facts on the ground. And I was just going through the Ghanaian Times, and I saw the Forestry Commission inaugurate a committee to develop an eco park. They are looking for $323 million.
They haven't gotten it yet.
They are going to, the Forestry Commission is going to provide $175 million. And through...
So you're saying what priority?
We are faced with this epidemic.
Prioritizing expenditure.
So if you blame the West, sometimes I have a problem because we are not prioritizing. Do we need an eco park now?
No.
Thank you very much.
All right. So Patrick Vuama is a legal practitioner, but is also a member of parliament for Okaikwe Central. He's one of the contestants for... no, you're not contesting for the flag bearership race.
No.
When is the election taking place?
Our special congress is on the 31st August, and the main one is October 18th.
Okay. Why are you having 2 events?
That's what the Constitution says. If you have more than 5 candidates, okay, you hold a special...
So the first one, you prune them down...
to 5.
Then the second one, you do the main election.
To elect 1.
Okay. Which of them are you supporting?
I can disclose. The rules are clear that if you're an MP or...
Don't let me go there. The last time you held a press conference, you were part of it.
Which press conference? I've never been part of any press conference.
Okay. We're taking a break, and we're grateful to you, Patrick Vuama, Member of Parliament for Okaikwe Central. We're taking a break. When we come back, we have a lot more for you.